Oops. Good evening, everybody.
Hi.
Welcome. So I'm going to introduce Michelle, and I put it in the chat that please put your NCAOM number and name into the chat so you can receive your certificate. Anna and I will be sending that out. I'm so happy to have Michelle here with us for this class. Michelle Gales is a Florida licensed acupuncture physician. She is currently on the doctoral faculty at USANA University. She is formerly a faculty and clinic supervisor at the Maryland University of Integrative Health. She was there from 2015. Can you everyone just mute themselves?
Sorry.
Just mute everyone. She has been there since 2005 to 2019. Michelle teaches facial acupuncture classes internationally, has been published in prominent acupuncture publications such as the Journal of Chinese Medicine. Throughout her career, Michelle has been sought out to lecture by numerous prestigious national and international organizations such as Pacific Symposium, the Florida State Oriental Medical Association, the Acupuncture Association of Chartered Physiotherapists, China Books, and American Acupuncture Council. Michelle brings a vibrant teaching style and a breadth of knowledge of facial and cosmetic acupuncture encompassing safety, ethics, theory, history, point location, and unique precision needling techniques. And please be sure to check out her new book, Treating the Face, a Comprehensive Manual for Acupuncturists. It's received rave reviews, and her classes can be found at facialacupunctureclasses.com. So welcome, Michelle. Thank you so much for being here and offering this class through ASNY. I'm going to pass the mic on to you and make you the host as well. You should be the host now, Michelle.
Okay. Great. Well, thank you, Shefali, and welcome everyone. Looks like we have a nice crowd, almost 100 people tonight. So I'm going to go ahead and share my screen. Can you hear me okay? Okay, great. So let's see. And there we go. I don't know what this is asking me. Okay. So I'm going to be speaking for about the next 45 minutes or so about facial motor points. And after that, I'm going to open it up for questions. So because we have such a large group, the questions will have to go in the chat box. And then Shefali, if you can kind of go through as the questions are coming in the chat, and that way I can answer pertinent questions and we won't have like duplicate getting the same question over and over again. So let me get myself out of the way here. Okay. I've already been introduced, but this is my bio, and I'm trying to figure out a way to get this thing out of the way. Sorry, guys. You think I'd never done this before? Ah, much better. So when I was asked to speak tonight, I was contemplating what did I want to present about, and I teach many different topics, but they all pertain to treating the face. So these are some of the classes that I teach, both recorded and live, and I will be doing a live hands-on class for the Acupuncture Society of New York on September 6th and 7th. And during that class, we are going to cover cosmetic acupuncture, some cupping and gua sha, and I'm also going to be doing a demonstration of microneedling. But tonight's talk is really uh, about not just treating neuromuscular facial conditions with facial motor points, but also how can facial motor points be weaved into our cosmetic treatments in order to really work with some of the more difficult conditions. But I want to check out some of my other classes like safety and ethics, red light therapy, and I even designed a facial acupuncture self-care class for acupuncturists. Again, these are some of my publications and my book. It is a over 500-page hardcover book, and you can get it on my website, which is listed here, and Lhasa also sells it. But essentially, every class I teach is broken down into a chapter. And so today I am really going to be focusing on facial motor points. Just a couple of pictures from the inside of the book. So what exactly are facial motor points? Are they something that are unique to acupuncture? Are they some new trendy thing that uh, people have just been using for specific, maybe sports medicine conditions? Um, well, motor points themselves date back to the late 1800s. And more recently, many of our contemporaries have done a lot of work with motor points and acupuncture, and primarily they're used when we think about sports medicine, but they can also be used to treat the face. This is actually, this was directly from my book as a reprint. The original of this image came from an old medical textbook, and it outlines all of the different motor points on the face and the neck. And it was a little difficult to read, so I had my designer go in and really label everything. And it really shows you, especially if you're looking at the different muscles on the face, and you can kind of see how some of these points are acupuncture points as well. So the motor points that are on the face, so some of them are actually acupuncture points, and some of them we have other landmarks that we use, but the facial motor points directly work with the frontalis, the procerus, the corrugator, the temporalis, which is on the side of the head, the orbicularis oculi, the zygomaticus major and minor, which have to do with lifting the cheek, the risorius, which has to do with pulling your smile this way, the masseter, the orbicularis oris, which goes around the lips, the anterior digastric, and that is under here, and also the platysma. So, but what exactly do they do? So if a muscle is in spasm and it's not working properly, putting an acupuncture needle into the motor point will cause the muscle to jump. It's like a reset switch, and it will allow it to be in normal function. So if the muscle is spasming, if it is too tense, or if the muscle is too flaccid, working with the motor point will enable the muscle to get back into normal functioning. So motor points, what they are is they are located at the most electrically excitable part of the muscle. So here's your muscle, and here is your motor nerve, not your sensory nerve that goes out to the skin, but the motor nerve goes down to the muscle, and the motor point is where the nerve goes right into the muscle. Now, these are not trigger points. Sometimes we'll use ashi points, and those are tender points or knots in the muscle, but motor points are not necessarily sore. So you have to know exactly where their location is. The reason why facial motor points are so beneficial in our practice when we're doing cosmetic acupuncture is because the skin on our face is the only part of our body where the muscle connects directly out to the skin, which is why we can move our forehead and our lips and our cheeks without having to use any bones. Normally, muscles connect to bones or to tendons, but on the face, they connect directly to our skin. If you tried to move the skin on your arms, you couldn't. You have to move another part in order to get the skin to move. And what that means is if the muscles become shortened, then we end up with wrinkles. So we want our facial muscles to be relaxed, contrary to some of the things that you might see on social media where they're trying to tighten your facial muscles. You really don't want to tighten them because that's just going to give you more wrinkles. So here's what I'm talking about. Here's a bone. Here's the muscle, here's some facial fat, and then this is the skin on your face. And you can see the muscle goes all the way out to the skin. Now, if that muscle is tight, then like this, you tighten your orbicularis oris, then you end up with wrinkles. You're going to end up with wrinkles in the skin. So habitual expressions or just muscle dysfunction, muscles atrophying, becoming, uh, not functioning properly over time can lead to skin wrinkles. So all the motor points that we use when we're treating facial conditions are all innervated by the seventh cranial nerve, except for the masseter, which is this big muscle right here that we use to chew, and the temporalis, which is on the sides of the head, and that is innervated by the trigeminal nerve. So when you're trying to figure out which motor point you need to use, you have to know which muscles are being affected. And as I mentioned, using that motor point will reset the muscle and allow the skin to lay flat. Facial motor points are also excellent for any condition involving paralysis. So if you have a patient with Bell's palsy, if they've had a stroke, if they have ptosis, one of their eyelids is lower than the other, or one of their eyebrows is lower than the other, using the motor points can help to get these muscles back into normal functioning. And the way you needle them is you're going to needle slightly off center and you're going to needle into the muscle, but not through the muscle. Um, so when you're uh, treating the facial motor points, you typically are working with the fascia, and this can also help with the appearance of the skin. And I have a picture of that, and I'll get to that in a second. So if you're wondering, like, when would I use these in my treatment? I'm already doing cosmetic acupuncture. The way that I think about cosmetic acupuncture is a basic cosmetic acupuncture treatment will help to lift the face, and it is wonderful to treat on a deep level, kind of a large brush effect for lifting and enhancing the appearance. But if you have a patient who has noticeable sagging in one area, really deep forehead lines, kind of that turkey neck situation, or really a lot of wrinkles on their neck, maybe they have tech neck from having their head down, staring at their phone all the time, utilizing the facial motor points can help with the digastric, can help with the platysma, can help with the forehead, crow's feet, and lines around the mouth. So quickly, if we look at this image here, we can see some of the visible signs of aging. So what are some of the things that happens to us as we age? We can get lines across our forehead. Um, and typically this is from raising our eyebrows frequently. And also we lose bone and fat in our temples, so we can get kind of depressions in that area. Lines between the eyebrows from making an expression of anger or maybe worrying a lot. Fat loss in our cheeks, and a lot of the fat that's on our cheeks kind of slides down the face, and you can end up with those deep, deep grooves under our eyes. And we get what are called nasolabial folds. So from the nose to the lips, we get these nasolabial folds. Hollowing in the midface area, and then wrinkles that go, or lines rather, that go from the corner of the mouth down to the jaw, and these are called marionette lines. That just changed all by itself. We can also get wrinkles in our chin, and this comes from volume loss and bone loss in the chin. So this would be perhaps a typical 35-year-old, not a lot of signs of aging, maybe just some minor aging around the mouth area from being very expressive. Then we get to 55 and you start to get more pronounced and noticeable signs of aging. And then by the time someone is in their 70s, if they don't get cosmetic acupuncture, they can have uh, more of the typical signs of aging. And everyone ages differently. When I teach, I go through all of the different um, kind of markers and indicators for how people age, lifestyle, diet, sleep, genetics, smoking, being out in the sun. And this is all a really important part of the knowledge of how to set realistic expectations with your patients when they come in. So let's talk a little bit about forehead wrinkles. And these can be really stubborn. Microneedling is great to treat kind of the superficial part of the forehead wrinkles, facial cupping and facial gua sha. You can actually do gua sha on the forehead, can help. But if the muscle itself is shortened, permanently shortened, and the person's forehead looks like this all the time, then you can do all of this work on the skin, but the wrinkles are just going to come back. So this was a patient of mine. She had been coming to see me for years. She was actually a pharmaceutical rep. She used to get neck pain, shoulder pain, wrist pain from carrying this big, heavy bag all the time. So she'd come on and off for many years. And one time she saw my brochure in my waiting room. She said, does that, she started getting into her late 30s, early 40s. I think she was in her early 40s. She said, does that cosmetic acupuncture stuff really work? She said her eyebrows were starting to kind of eclipse her, the frontal part of her forehead, and her eyelids were starting to droop. So I got her on the table and I just treated one side of her forehead. I used a motor point and I did a couple of other acupuncture points and some other lifting techniques, but just on one side. And I left the needles in. I treated her shoulder. And when I came back in the room, I took the needles out and I gave her a mirror and she looked in the mirror and she was horrified. And I said, what's the matter? She said, I can't go home like this because one eyebrow was way up and the other one was, just kind of drooping. So anyway, she came to see me for cosmetic acupuncture for many years after that. So the motor point for the frontalis, which can help with kind of the forehead lines, and it also helps with the drooping eyebrows and eyelids, is right in the middle of the frontalis muscle. And lucky for us, it is gallbladder 14. So you would just use an oblique insertion, stimulate the needle a little bit, and it can help to get that frontalis muscle back into normal functioning. This was another patient of mine, had come for some cosmetic concerns, and I put the needle in. And as soon as I put the needle in, it immediately the muscle started twitching, and the needle won't always twitch, but frequently it does. And that's how you know that you've gotten the motor point. This was a student of mine when I was teaching. I think I was in London. Um, he had fallen off of he had a bike accident, had hit his head and had some nerve damage. And he said he couldn't raise his left eyebrow. And so I was doing some submuscular needling and put the I put the point in for gallbladder 14. And as soon as I put the needle in, you can see the needle starting to move. So after that, he was able to lift his eyebrow, which was pretty amazing. Another concern that patients will come to us with is lines between their eyebrows. They'll get a deep line between their eyebrows. We call this the liver line because it's usually when someone's very angry and frustrated, or they'll get the two lines. We call those gallbladder lines because they're usually from just thinking a lot, making decisions. So the motor point, so the corrugator, which is this muscle right here, and these images are from my book, by the way. The corrugator um, holds the eyebrows together so you can make that kind of angry face. Um, and the motor point for the corrugator is just lateral to bladder 2. Also, the procerus, which is right here, the motor point for that is yin tang. I don't have that on this slide. And those muscles work together, and they also can cause that bunny line, which is a line that goes across on the bridge of the nose. Oh, I do have a slide for it. So that's what that looks like here. It can give you that like wrinkle on the top of your nose. A lot of people, as they age, just from making habitual expressions or volume loss in the chin, they will get wrinkles in their chin. And and your patients who perhaps have had Bell's palsy or have had a stroke can have trouble pushing their lips together. And the mentalis um, is here, and that comes into play. And also the depressor labii inferioris, which is just lateral to it. And these muscles work together to depress the bottom lip and can cause those lip wrinkles. And the motor point for that muscle is the extra point, which is just one soon lateral to REN 24 to CB24. And then for the mentalis, so this is the depressor labii inferioris, and this is the mentalis. And the motor point for that is a half soon lateral to REN 24. So you would usually do both of those if someone was having trouble whistling, closing their lips. One of the tests that we do with Bell's palsy, we ask the patient to close their lips and blow out. And that way we can see um, if air is puffing out, that means they can't press their lips together. This was a student of mine in one of my classes. She had had Bell's palsy, and I was doing some advanced cosmetic techniques on her, doing some submuscular needling. And she had mentioned that she had had Bell's palsy many years prior, but she couldn't whistle. When she would brush her teeth and she'd go to spit, she said she would kind of drool. It was hard for her to drink through a straw. And so I went ahead and put the motor point for the mentalis in. And as soon as I put the uh, the needle in, immediately you can see the muscle twitching. And so I stimulated it just a little bit, and the muscle really jumped. Where am I? Lip wrinkles are another concern that patients will come to us with. And on a superficial level, lip wrinkles can be treated through microneedling, through depending, you can use intradermal needles, some threading, but what can really help to relax that orbicularis oris around the mouth are the motor points for the orbicularis oris. And in this instance, there are two motor points. And so this yellow here is the orbicularis oris. And the two motor points are LI19 right here. And so you would needle through this muscle right here, and you would needle into the orbicularis oris. And then here you would be needling through the mentalis, and you would be needling into the orbicularis oris. And this motor point is between stomach 4 and Ren 24. So depending on whether or not both sides of the mouth are affected or whether it's just one side, you're going to treat the area that's affected. There's no sense in treating a muscle on the other side of the face that's not affected. So some other uses for motor points, as I mentioned, are the nasolabial folds, the marionette lines, crow's feet, and also treating the anterior digastric and the platysma. And in my book and in my lectures online, I go through every single muscle on the face and the head and the neck and where the motor points are and how to needle those in order to help to get these muscles back into normal functioning. And in some instances, when we're thinking about the neck, we have to treat the back of the neck as well, because so many of the issues with the front of our neck and with our face have to do with our head posture. If you have a downward head posture all day long, you are going to end up with issues in the back of your neck. Also, the downward head posture, your mouth tends to fall open, and the mentalis muscle and the masseter muscle can become elongated. It can pull on the temporalis, and all of the muscles in the face are connected in one way or another to the muscles on the head. We have um, the top of the head. We have all these different points that connect onto the temporalis, and we have the occipital frontalis band. And so treating the occiput is very important when we're treating the face, and also treating the auricular muscles, the muscles that go around your ear, are important for treating the face because it's all connected. So some other uses for facial motor points, as I mentioned, are treating conditions like Bell's palsy, Ramsay-Hunt syndrome, synkinesis, which is where when you move one part of your face, another part of your face moves involuntarily. Stroke, TMJ, facial motor points are wonderful for treating TMJ. There is a motor point for the masseter, and there's actually two of them. And our patients that come to us with facial pain or tension, using those motor points can be really beneficial. kind of coupled with, so I use a multifaceted approach. And if you go on my website, I have a whole resources section. It's facialacupunctureclasses.com. And I talk about um, many different things, and one of which is the importance of using a multifaceted approach when you have stubborn conditions, things like TMJ, doing submuscular needling, treating the motor point for the masseter, and maybe even doing some scalp acupuncture, and then weaving in some facial cupping and gua sha. Using this multifaceted approach is going to give you the greatest effect when you're treating the face. MS is a fairly common condition, and this can absolutely affect the face. Ptosis can be, that is a drooping of the eyelids, that can be congenital. It can be from an injury. It can be just from loose skin. It can also be from aging and stroke. There are a lot of different conditions that can cause ptosis. It is one of the residual conditions people can have if they've had Bell's palsy and they don't recover fully. Hemifacial spasm, and I just wrote an article about this on my blog, on my website. Hemifacial spasm is different than a facial tic, but hemifacial spasm is something that can go on like during the night, and whereas facial tics are really kind of transient, hemifacial spasms can incorporate the entire side of the face, and motor points can help with that. And also myasthenia gravis, which is a muscular condition. So just a quick glance at some of the other facial motor points. I had talked about the zygomaticus major, and the motor point for that is small intestine 18, and that that muscle is used to make a genuine smile. Contrary to what you may have been told, it actually takes more muscles to smile than it does to frown. Sorry to burst your bubble. And the zygomaticus minor, which elevates your upper lip, and the motor point for that is between stomach 2 and LI 20. And the motor point for the risorius, which is what draws the angle of our mouth this way towards our ears. And the motor point for that is just lateral to stomach 4 on this area of the mouth right here. See this little round dot? That is called the modiolus. And just looking at it, you can see how many different muscles are actually attached there. So treating just this one point can affect all of these muscles. So I guess I was talking faster than I thought. I'll have a couple of extra minutes for questions. I do have upcoming classes in New York City, in Dublin, Los Angeles, Fort Lauderdale, Sarasota, and Sydney, Australia. I also am going to be in 2026, I'm going to be in Houston and Scottsdale and Switzerland. I will be in Switzerland. So, uh, again, my classes include over 20 hours of recorded lecture. And then when you show up, we do a review and a demo, and then we have 2 full days of practice. My class in New York is going to be a little different. There'll be a little more lecture involved. So you might want to check that out. And that there's a link to even though the New York State Acupuncture Association is sponsoring the class, there's a link on my website that'll take you there. And I don't know if we're still in the early bird period. So you can check all that out. You can also follow me on Facebook, Instagram, and there's my website. When I'm teaching, if you have my book already, you can bring it and I will sign it. I was doing a book signing at a conference I think I was in Houston. Um, and I gave a half day talk and then I did a book signing and sold a few cases of books. So it was a lot of fun. I hear somebody needs to be muted. I guess I can mute them. Okay. Okay, so I'm going to stop sharing my screen and then I don't know if there's any questions in the chat. Shafali, do you want to?
We have one question here.
Okay.
It says, how deep do you needle the facial points? It is hard to see from the photos, but it looks like the needle is in up to the shaft of the handle.
No, not at all. The uh, depth that you are going to needle is you are needling through the skin and into the muscle. So the answer is it depends because some of our facial muscles are very superficial and so they would be needled more superficially. And some of our facial muscles are deeper, and so you would needle more deeply. And the skin on our face varies in thickness as well. So if you were, for example, needling a point on the forehead, the skin is a little thicker than if you were needling a point for the orbicularis oculi, where the skin is much thinner around the eyes. So the information that you need when you're learning how deeply to needle is where is the muscle? In other words, is because all the muscles on the face, most of the muscles on the face, not all of them, are layered. And so you might need to go through one muscle. Remember when I was showing um, the mentalis, you had to go through the mentalis to get to the orbicularis oris. So sometimes you have to go through one muscle to get to the next, and other times the muscle is going to be very superficial. Also, if you're uh, muscling, if you're needling on the cheeks, let's say, where there's a lot of facial fat, that you have to take that into account. So it really depends on the person's anatomy and which muscle we're talking about, but you're not looking at the sewn depth, the way that we would normally determine when you're needling an acupuncture point. It has to do with general anatomy and then their particular anatomy. Young people have thicker skin than older people. And as a rule, not always, but typically, um, our skin gets thinner as we get older. So you would needle, if someone was in their 70s and you were needling a motor point on their face, you would needle it more superficially than if someone was a teenager. Are there any other questions?
We have some questions about bruising, about like what do you do when you accidentally leave a bruise or how do you avoid it?
Okay, so that's a great question. Probably the most common question that I get And um, it's a fairly long answer, but I can kind of give you the shortened version. And so the first thing is to take precautions before you needle. So I use arnica gel. And of course, when you're doing your intake with your patients, whenever you're working on their face, you need to ask questions about, do they bruise easily? And people usually know, because they'll have random bruises on their bodies and they'll say, well, how did I get that? Uh, and also, are they on blood thinners? And people who are moderate to heavy drinkers, especially if they're drinking the night or 2 nights before or days, whatever they're doing, before they come in, alcohol thins your blood. So they will bruise more more easily. So you use arnica gel, and then you have to use specialized needles for the face. Now, it doesn't mean you have to go out and buy special face needles, but there are acupuncture needles that are very high quality, like Sarin needles, which are very thin and made really, really well, and they are not going to cause as much trauma. So that is important as well. And the next thing that's very important is to have good lighting in your treatment room. And the reason why this is important is if someone has a superficial vein, so you do need, that's another part of the answer, you do need to know your facial anatomy. Where are the facial veins? And uh, there are major veins that run through the face, and you can avoid them if you know where they are. And then if you have good lighting in your treatment space, then you can certainly see where any obvious veins are. And then you needle gently. As you're needling, if you feel some resistance, you don't push through it. So really having some precision needling techniques in your toolbox are important. And I spent a lot of time in class uh, talking like skills and techniques because it's so important, because no one is going to have a viable cosmetic practice if they keep bruising their patients. So a lot of the pictures that you see, images that I probably see more of them than most people, because people are always sending things to me saying, look at this, look at this. So a lot of those images you see with people with 50 or 100 needles in their face, you don't need to do that. You don't need to manipulate the needle and cause all this trauma to the face. You really do have to be gentle when you're working with the face. All of that said, what if you are needling a motor point and you take the needle out and there's some bleeding, or and you think that they may start to bruise? I have Yunnan Bio spray that I'll put on a Q-tip and I'll press it down. If you can't get your hands on that, you can use arnica gel. Um, the other thing is facial cupping can really help to move the blood and prevent that pooling and bruising. So, but you have to understand which way the lymphatic system goes on the face. You don't want to make matters worse and draw the blood into their eye or um, against the flow that you want it to go. So those are all a bunch of things that can help to prevent bruising.
We have another question about how do you treat hollowing of the cheeks?
So that's a very specific cosmetic question. Um, and it really depends on why they have the hollowing. If they are lacking facial fat, you can work with the muscles in the area through submuscular needling and some motor points to kind of help the muscles themselves. However, if they are missing a significant amount of fat in their face, this whole GLP-1 um, thing, I don't know what else to call it. People are taking medication and they're losing tremendous amounts of weight very quickly. Their face is looking hollow. They're having a lot of sagging in their face. It's great for business, but what do you do when someone has lost all their facial fat? We can't put it back. We can't. We cannot bring fat back into the face, but what we can do is tighten the skin that's there. So by working with microneedling and working with some of the motor points, because the skin doesn't just the face doesn't just age on one level. Um, it ages on many levels. We lose fat, we lose muscle, we lose bone. The skin itself ages. And one thing I didn't talk about is or I touched on it, but is the facial fascia, which is like this network that helps to hold the face up, that you can get fascial adhesions, which can cause issues as well. And needling the face, mainly with submuscular needling, but needling the face can help with those fascial adhesions as well as cupping and gua sha.
We have
Any other
another
question?
question about explaining what Botox does to patients versus motor point acupuncture.
So, Botox does the complete opposite of what facial motor points do. Botox paralyzes your facial muscles, and um, it it has been found in the cerebral spinal fluid, and um, it over time. So there's a lot. I have pages in my book about all the stuff that people do to their face, the fillers, the Botox, the lasers, the all of it. But over time, over many years, Botox stops working. Your your neuromuscular system kind of figures it out, and then you are left with a muscle that's in really bad shape because it's been paralyzed for weeks, months, years, depending on how long you've been getting the Botox. But let's say you have a patient and they've been getting Botox and they say, I'm just tired of it. I don't want it anymore. I don't like the way it feels. I don't like the way it makes me look. And they come to you. First thing they need to know is the work that we do can make the Botox wear off. So you don't want to be needling in the area where they've had the Botox if they want it there. If they don't want it there, or if they're trying to avoid having Botox, um, needling in that area can help relax the muscle, which is so Botox will relax the muscle, right? But it also paralyzes it. We relax the muscle and it can still move. People can still raise their eyebrows and purse their lips. Um, and when they smile, their cheek will still go up fully. Uh, so in in kind of loosely in theory, it does the same thing because it relaxes the muscle, but it doesn't paralyze, or we don't paralyze the muscle.
We have another question about how many treatments does it usually take to see a cosmetic change, and how often do you need to be treated to maintain the relaxed muscles of the face?
What was the last part?
How often do you need to be treated to maintain the relaxed muscles of the face?
So this is another it depends question because you have 100 people in the room. They're all going to need different treatment. It's like saying, I've got a pain in my neck. How many treatments is it going to take before the pain goes away? Well, it depends. So it depends on a lot of factors, as I touched on before, their age, lifestyle, skin condition, sun, smoking, eating, drinking. There are many things that uh, can cause people to age prematurely. Um, I just was looking at an article the other day, study, you could probably find it, look it up, study done on twins and their skin. One lived in Florida, one lived in Minnesota. One was overweight, one was normal weight. Just different things will determine. So when uh, probably one of the biggest parts of my class is the intake, and it's a big section in my book as well. When you're sitting with your patient, how do you speak to them? What questions do you ask so that you can put that treatment plan together? Because we're not taught this in acupuncture school. We're taught this with, aches and pains and IBS, how to speak to our patients. But when it comes to the face, depending on all those factors, typically people come to you once a week, I'm sorry, once a week for about 3 months. If a person has mild to maybe moderate, like early signs of aging, someone maybe in their 30s or 40s, average amount of aging, not someone that has been living in the desert or in Florida their whole life and they're an avid tennis player, gardener, out hiker out in the sun all the time. They're going to need more treatments. And the reason for this 3 month mark is it takes about 12 weeks to really get the collagen built up, which is why when you do microneedling, it's one treatment a month for 3 or 4 treatments. So it's the same principle. And then usually my patients will start, instead of coming once a week, they'll come every other week, or eventually they come once a month for maintenance. But for many of my patients, it's part of their self-care and they come like clockwork. Um, I had 3 patients when I was in Maryland. I had 3 patients that came to me for once a week for almost 20 years. They loved it. It relaxed them. It relaxed all of them because when I do cosmetic acupuncture, I don't just treat the face. This is not carrying a meat suit around. You have to do a full body treatment. You have to treat all the organs. You have to treat their blood and dampness and any sort of excess or deficiency. It all has to be treated. So they're getting a full body acupuncture treatment every time they come.
I think to go along with that question, there's another follow-up, another question that relates to that. It says, how much time do you allow for insertion and retention, and what is usually included in the aftercare?
Aftercare, I might need a little more. There really isn't any. I'm going to start with the end of the question. There's really no aftercare. I mean, I tell my patients, I recommend that in between treatments, they maybe do some derma rolling. But they don't, it's not like microneedling where they walk out and their face is, red and they have to do something. Um, I just recommend that they take care of their skin. But as far as, I mean, I can put the needles in about 10 to 15 minutes. Most practitioners are going to take 15 to 20 until you kind of get the hang of it. And then they will rest on the table for a minimum of 15 minutes. It just depends. If you have two rooms going, you need more time. With your other patient, you can go into the other room, put the needles in your other patient. So patient A can lay there for a half an hour with the needles in. Most of my patients just fall asleep when the needles are in. You could put red light over them and while the needles are in, and this works very much on a superficial like skin level. Then you come back in, I pull the needles out, I do cupping and gua sha really quickly, probably 10 minutes, and that's it. So depending on how much kind of threading I'm doing, how much talking is going on, and I always discourage my cosmetic patients from talking once the needles are in, because that's another way that they can bruise. Um, so all of these things, can add up to a treatment that is anywhere from like an hour to an hour and 15 minutes. And, there's going to be a few minutes there of, um, pulse taking and them getting dressed or whatever. But yeah, it does not have to be a difficult, complicated thing. It is the most relaxing part of being an acupuncturist for me because I sit down when I work. So I'm relaxed, they're relaxed, and got the nice music playing. It's very relaxing.
Thank you, Michelle. We really appreciate it. There are a couple more questions if you have time. Um, we can
Sure,
address
I'll take I'll take two more.
two
How's
more.
that?
All right.
Yeah.
So we have a question about let's do this one. What is too much in one session? For example, if they're addressing a few different areas of concern, the jowls, TMJ, eyelid drooping, is there a concern of needling too many areas in one session?
So many areas in one session. Well, it just depends on how much time you have and how fast you can needle. Any of you who have been to my class, you especially, so I have the way my class is set up, we work on the foundations, all the basic techniques, and after that, you're kind of good to go, right? You learn the basics, but on day two, we do cupping and gua sha, and we also work on some of the more advanced techniques like the submuscular needling and the motor points, different things. These are the things that can take a little longer, but I only mention class because when I'm doing my demos, I get someone on the table and I do everything, and and I haven't lost anyone yet. So there's really, if you have someone who's very needle sensitive, you have to be mindful of that. It has to do with your patient, how much time you have, but that's why the body points are so important because you have to keep your patient grounded. You can't just go up to their face and be putting all these needles in their face. It can cause a rush of energy up to the head. They can end up with a headache. So,
Okay, and
and what
then
was the other?
last question is, will red light worsen melasma or hyperpigmentation?
Um, well, it can, and the other spectrums like yellow and green tend to be better for those things. So you might want to, again, if you go over to my website, I I'm about 90% sure I wrote a blog just on that. And my book has a whole chapter on LED and red light therapy. So, okay. Well, hope to see some of you at some point in one of my classes, and definitely in New York. We're going to be at Pacific College, and which I'm looking forward to. Haven't been in New York in a while. So, thank you all for coming. And if you have questions for me, the best way to reach me is to go on Facebook. I know, Facebook, but go on Facebook. I have a group called Facial Acupuncture. And if you join it, you can ask a question and I will answer it there. And everyone gets there's over 10,000 acupuncturists all over the world in the group. So thank you so much.
Thank you, Michelle. Thank you, everybody. Have a good evening.
Bye-bye.